This annual competency meets OSHA requirements for respiratory and bloodborne pathogen protection and is based on 2016 CDC guidelines for infection prevention in ambulatory care settings. We will review the use of transmission-based precautions, including the use of personal protective equipment with advanced respiratory protection, as well as exposure management in the outpatient environment. Transmission-based precautions, otherwise known as contact, droplet, or airborne precautions, are infection control measures used in situations where standard precautions alone will not prevent the spread of infectious agents. In these situations, the protection of healthcare personnel from exposures requires the use of personal protective equipment, or PPE. PPE acts as a barrier to prevent or limit contamination of skin, mucous membranes, and clothing. This includes the use of gown, gloves, mask, eye, and respiratory protection. For a detailed reference regarding types of isolation measures, please refer to Fundamental Principles of Infection Prevention, available on the Pulse under Foundation Clinical Resources. Since exposure risk is based on the suspected infection, it is always best to protect yourself to the highest level of precaution. Consider the task you're performing when selecting PPE, because the decision to wear it is based on the risk associated with the activity you're performing and the type of microorganism you may come into contact with. For example, if you suspect infections such as norovirus, lice, or shingles, with fluid-filled vesicles present, at minimum, gown and gloves should be worn. If you're at risk of splashes, such as during wound irrigation or specimen collection and processing, gown, gloves, and mask with face shield should be worn. Please keep in mind, when droplet precautions are needed, at minimum, a surgical face mask with shield should be used. If you're suspecting measles, varicella, or TB, a powered air purifying respirator, or PAPR, should be worn instead of a simple face mask. Let's take a closer look at why. A face mask, if properly worn, is designed to help block large droplets of splashes, sprays, or splatters. Because they are fairly loose-fitting, a face mask does not filter or block the very small particles in the air, such as those that may be transmitted by certain coughs or sneezes. Because the gaps around the face mask allow small particulates to be breathed in during inhalation, it cannot be worn to resist infections such as measles, varicella, and TB. As opposed to a simple face mask, the PAPR uses a filter to remove harmful substances from the air and prevents inhalation of small and large particles. It offers the best protection when working in close proximity to people who have symptoms of a droplet or airborne transmitted infection. Recognizing this difference is essential because in ambulatory care, we often are unaware of the patient's diagnosis before providing care. We need to be diligent and proactive when it comes to using the proper PPE, otherwise we're left at risk of exposure. The sequence for donning and doffing PPE with a PAPR differs slightly from using a simple face mask. In situations requiring advanced respiratory protection, the CDC recommends following guidelines from the manufacturer of the respirator. The upcoming video demonstrates the recommended sequence for donning and doffing PPE with a PAPR following CDC and manufacturer recommendations. But first, let's take a closer look at the PAPR's design. The PAPR filters environmental contaminants and delivers purified air to the user. Within the helmet, LED lights are visible in your upper peripheral vision. These lights display the status of air filtration and battery power. Yellow will light up if there's an issue with airflow or the filter needs to be replaced. Green indicates the remaining battery charge. 3 green lights equals a full charge, 2 equals about half charge, 1 equals 25% charge, and red with no green lights indicates the battery needs recharging. The PAPR should not be used unless green lights are visible. The PAPR should be stored on a cart or inside a clean, covered area accessible to all staff who may need to use it. The storage area should contain PAPR supplies including 1 PAPR unit with battery packs, belts, and chargers, disposable cuffs, comfort strips, and filters. Alongside PAPR supplies, there should be gowns, gloves, and appropriate disinfecting wipes. This will be your gray or orange top standing cloth. It's best practice to clearly label the area where personal protective equipment is stored. If additional supplies are needed, please notify materials distribution. If the PAPR is non-functioning or damaged, please notify biomedical engineering. So, what if a person arrives to the office with symptoms of an airborne transmitted infection? Several examples are listed here. What precautions should you take? If a person arrives to the office who is known or suspected to have an airborne transmitted infection, specific steps must be followed to minimize exposure. First, Instruct the patient to put on a mask. Immediately place the patient in a private exam room with the door closed. Transport or movement of this patient should be minimized. Next, the healthcare worker must don a respirator as well as gown and gloves if needed before entering the room. After providing care, gown and gloves, if worn, are removed before leaving the room. The respirator is always removed last, however there might be a slight variation as to when and where it's removed. Under droplet precautions, remove the mask or PAPR before leaving the room, as close to the exit as possible. With airborne precautions, the PAPR should be removed after exiting the room, just outside the door. Once PPE is removed, perform hand hygiene before leaving the patient care environment. Please instruct the patient to wear a mask when exiting the room. Once the patient leaves, the room should remain vacant for the appropriate time. Generally, it's at least 1 hour to allow for a full exchange of air, but room vacancy time may be significantly longer depending on the illness and the building structure. 1 hour is just the minimum guideline. Next, wearing the appropriate PPE, such as gloves, clean and disinfect the exam room. Again, disinfection standards might vary based on the exposure. Lastly, we document the procedure and, if necessary, report the exposure. An exposure incident relates to blood or other potentially infectious material coming into contact with mucous membranes such as the eyes, mouth, or non-intact skin. After any exposure incident, employee health should be contacted and immediate self-care steps must be taken. If you are involved in an incident where an exposure may have occurred, please take the following precautions. Wash the wound with soap and water. Flush mucous membranes with a large volume of water. Don't squeeze the wound or apply any disinfectants. Complete an online Risk Manager employee occurrence report. Notify your manager or supervisor. And report to employee health or emergency services within 1 hour of the injury. If it's during business hours, please report to employee health. If it's after hours or on the weekends, please report to the emergency department. Now we'll take a few minutes to review the best practice for donning and doffing PPE with PAPR.